be here. Are we rolling? Okay. Should you see the audience? So all of them, show yourself.
Oh my God, look at that. Let me get side of Ray, that's good enough.
Be sure to turn around and show yourself. There you go, like that. And then the cards. Like that, there we go. Alright.
Does it have audio?
Yes, we have audio.
Watch what you say.
You ready? Alright. How many of you are familiar with the idea of teen angst? Yeah, actually, yeah, me too. How many of you kind of rolled your eyes when you've encountered a moody teenager? I know I've done that too. However, according to Richard Allen in an article called Antidepressant Treatment and the Risk of Suicide Attempt in Adolescents in the journal CNS Drugs from 2004, fully 5% of teenagers in the United States, that's 2.1 million teenagers, have some kind of major depressive disorder. They're not just a little sad, they have a major disorder. They are clinically depressed. That is a lot of teenagers. And with this many teens who are affected, most people know a teenager or know somebody who has a teenager with clinical depression. It could be your own child, it could be your grandchild, it could be a coworker's child. All right? And I am the parent of a young lady who had had clinical depression as a teenager. She was treated with a cocktail of drugs, and she survived into adulthood, fortunately. But there were times when we were wondering whether she might not. It's a pretty serious thing. Major depressive disorder, or MDD, can have very, very far-reaching consequences for teenagers. It's considered to be a gateway disorder because it can lead to other more dangerous or severe disorders later on in adulthood. Common treatment is with antidepressants, but there are concerns with the use of antidepressants in teenagers, safety concerns. These concerns actually sparked an investigation of the FDA by Congress in 2004 and led to them requiring that drug companies put warning labels on their packaging in regard to the safe use of antidepressants in teenagers. Also, kind of as a note here too, the New York Times earlier this year, in 2012, back in July, reported that GlaxoSmithKline, the company that makes Paxil, agreed to pay $3 billion in a settlement involving fraud in regard to their promotion of their drugs to children. And also they helped apparently to publish a medical journal article that misrepresented data from a clinical trial. All right. So obviously there are some concerns there. That there are concerns, there is no doubt. However, the degree of the safety and those concerns is really kind of what's in question here. The safety concerns can be broken into two groups. There's psychological concerns and there are physical concerns. Psychological risks can include increased hostility in an adolescent taking antidepressants, increased anxiety, and an increase in suicidal thoughts. According to Dr. Amy Chung and her associates in an article they published in the Journal of the Canadian Academy of Child and Adolescent Psychiatry, also in 2004, there are extreme physical risks that can result from this as well. Increased risk of suicidal behavior, actually attempting to take their lives, as well as an increased risk for self-mutilation. They found instances where some teenagers wound up in the hospital. It was so severe. There's also a small risk of kidney infection that they found in some of the studies. However, as I said, there have not been that many studies. There's been a lot of clinical trials with adults. Not that many have been done with teenagers in antidepressants. And that has left doctors kind of floundering when it comes to prescribing antidepressants to teenagers. They're left to kind of make their own best guess, and as we've shown here, some of the research itself is suspect. What it really comes down to in the end is this. You have to ask yourselves, and the doctors have to ask themselves, are the possible negative side effects outweighed by the benefits to be gained by prescribing antidepressants? Is the disorder itself more of a threat than the treatment? I'm going to show the audience again.
Oh, my God.
You got everybody? Show yourself. And we're out. Hit the button.